As I gingerly picked up his scrotum, I realized this is about the size of a basketball. A small basketball, but a basketball nonetheless. And this man was not much taller than me, maybe 5'8", 5'9". There was a visible opening that he said was related to where he had shaved. So he shaved his scrotum. He said, I might have nicked myself. This happens to lots of people, folks. Please stop touching your genitals. As I'm assessing, I'm noticing yellow, red, green drainage coming from the opening in his scrotum and little tiny wiggly things.
Back with another hot one for y'all today. In this video we have today, this is pretty, if the title is anything to go by, this is some pretty disgusting stuff. We have a nurse telling men that they should stop shaving their genitals and kind of provides a really disgusting story about what happened to a man who shaved his genitals and what happened to him after that. So y'all already know what it is, man. Y'all please go ahead, sub up. It really helps the channel. That helps me out, man. And we gonna get right into this one, man. This is pretty crazy stuff.
The amount of genitals and bugs. Story time. A 30-something-year-old male comes in complaining of groin pain. He felt movement in his scrotum that wasn't the usual ball sack movement. He said, "It's been hurting for a little while." What's a little while? Like 3 weeks. 3 weeks of groin pain is not normal. Any other complaints? He said no, just this. Proceeds to fling open his gown and his sheets and show me the largest scrotum I have ever seen. There were also things moving next to it. This is a much more recent story than the one that went viral. So you can imagine that I start thinking terrible, terrible things. I asked him how the pain started, what the symptoms were, if there was anything that precipitated this particular instance. He said what every single scrotal abscess person says to me when I ask that question. Every single, how often does this happen? A lot. This happens a lot. Leave your genitals alone, please. So I asked him what happened. He was just shaving like he normally does. Just shaving his ball sack. He was in the shower, everything was clean. When I got a report on this gentleman, I only heard scrotal edema. I was in a considerable amount of pain, so I assessed everything that I could normally, and then I went for the scrotum. As I gingerly picked up his scrotum, I realized this is about the size of a basketball. A small basketball, but a basketball nonetheless. And this man was not much taller than me, maybe 5'8", 5'9". There was a visible opening that he said was related to where he had shaved. So he shaved his scrotum. He said, I might have nicked myself. This happens to lots of people, folks. Please stop touching your genitals. As I'm assessing, I'm noticing yellow, red, green drainage coming from the opening in his scrotum and little tiny wiggly things. It is kind of a wriggling motion that's normally in the scrotum, so I had to double take at first to see what exactly I was seeing and feeling, because it felt like individual little pieces were wriggling, not like the whole. When I look down, I don't need to squint to see that there are also little trails on his chuck pad. I don't know where the trails go except for off the bed. And then I realized I looked down onto the floor and there are maggots on the floor.
That is disgusting. Why is it always maggots? Okay, first of all, this woman is a very good storyteller. And second of all, if anyone thinks this is like a HIPAA violation or anything like that, I think that they have to disclose the person's name for it to qualify as a HIPAA violation. You know, her telling these stories. I don't know if she, tells a lot of these stories, her being a nurse or, just disgusting things she sees in the field. But for her to talk about this, like it's some normal, so normally, and that this happens a lot and a lot of people nick this stuff and things of this nature, she's talking like, bro, that is insane stuff. I mean, I'm pretty sure most men can attest to, doing something like that, maybe nicking themselves or, grooming themselves or anything of that nature. But no one ever thinks it's, something like that's gonna happen. Just maggots, no one's ever gonna think something like that could happen. And again, I don't know why it always has to be maggots. It's the most disgusting thing you can think of. But we're gonna let her finish her story out.
There are maggots in the bed. There are maggots crawling up his thigh. There are maggots crawling almost to his head. This is the worst Dr. Seuss book that ever existed. Literally almost dropped his scrotum and felt like the worst nurse ever, but I maintained my composure and I gently set it down on the pillowcase support that we had provided for him, and I said, I need to go get some supplies so I can clean this and make this way more comfortable for you. Would you like some pain meds? This looks incredibly painful. As I put the scrotum down on the pillow support, it gushed serosanguinous, very purulent, smelly, cheesy, yellow, awful. Grab some pain meds and some cleaning supplies as per our wound care orders, and a large bottle of packing for this particular wound, which had already had an IND. Gentleman was the nicest gentleman I've ever met, by the way. And as I was packing his wounds, he did very well in tolerating the procedure. And volumes, huge volumes of pus coming out of his scrotal sac with a variety of other things. Once he was all cleaned up, he was very grateful. I said, dude, you know what? I feel so bad for you. I'm so sorry this happened. This is not a big deal at all. But please, please stop shaving your balls. Nurses, friends, family, whomever you are, please leave your genitals alone. This is the 100th case, I feel like, I've had of some sort of insect in a genital opening because someone has harmed themselves inadvertently by manscaping. It's not worth it. Just wax. I don't know. Just stop shaving. Stop shaving your genitals.
Yeah, man, absolutely disgusting. The fact that she said just hundreds of cases, you know, our 100th case of insects on the genitals, man, and that she's seen this and that this is so normal to her, man, it is terrifying. And, you know, kudos to her for remaining calm in that situation. Just, you know, seeing the maggots, seeing the pus, seeing all that stuff. Kudos to her and all the other nurses out there, man, who can remain calm in these situations, man. I'm a dude. I'm a pretty, you know, salty little guy. But even just the sight of, you know, even blood can sometimes turn me. So for her to see that, man, and to remain calm and make sure he's okay, ask him if he can, you know, go through her procedures, everything like that, man, that speaks wonders of what these nurses have to go through. Strong people for sure. Yeah, but that's all I got to say on that one, man. Please leave a comment down below. Let me know what y'all think, man. I gotta hear what y'all got to say about this one, man. Pretty crazy stuff. Let me know if y'all gonna stop manscaping or, you know, doing stuff around that area. And y'all go ahead, leave a sub, leave a like too, man. It really helps the channel out, helps me out, helps us grow. And if you made it this far in the video, like I always say, man, I just appreciate you, man. I just appreciate you guys sticking it through. But with that, man, I'm gonna catch y'all next time. Peace.